Okay, some mewing questions. We're taking questions off our YouTube channel. So if you want to ask a question, you've got some problems with mewing and you want my advice, if you write a question down in the comments below, our team will look at them and I'll select some out that we feel are helpful and informative and help people moving forward on their mewing journey. So first question is, I am 21 years old. When I do mewing, my double chin doesn't disappear. What am I doing wrong? Well, Minnow, first you're expecting your double chin to disappear. Please get the Mewing app, for crying out loud. These are some of these. I'm answering them, but they're silly questions. When you mew, you're taking some of the volume here and you're moving it up onto the roof of the mouth to create pressure to develop the facial form. Okay, that's what should happen naturally. So when you get a suction hold, that happens. You raise the area up again. You can see that area lifts up. But also when you're mewing, you're unwinding one of the two major compensations. So we have two compensations most people do because they haven't got full facial development. They lack tongue space. The first compensation is to move the tongue out the periphery of the dental arches. So you've got the teeth like this and the tongue then laps out somewhere. It has to escape. There's no room. It needs to get out of there. Now the second compensation we tend to do is a forward head posture because that opens up the airway. If you have a forward head posture as your normal default position, like that's how you are, then there's a good chance you won't have a double chin because you're holding your head forwards. So when you go back to your natural position, which isn't your normal's with a forward head posture. So most people, even me, when I go back to fully head tight, I'm a modern individual. I don't have the development our ancestors did. But when I go back to completely, so the tragus of my ear is above the insertion of trapezius, approximately. When I do that, you can see it doesn't look like I'm as well defined. I don't quite have a double chin, but I don't look as well defined on my jaw. Okay, for most people, you're going to get a double chin when you do a proper, well, we call it the Mackenzie chin tuck, I call it Rosie's chin tuck. The version I give that has been popularized is actually a version my sister, Rosie Mew, developed, but it came from the Mackenzie chin tuck. Okay, so if you're going to do the Rosie chin tuck, okay, most people are going to get a double chin. So, Minnow, you asking me why your double chin doesn't disappear, I'm thinking, well, it should appear when you're doing a chin tuck with your mewing. The fact that you raise some of the volume here up, I don't think, for most people in a normal situation, that's not going to be enough to compensate for the chin tuck. All right, so think about what you're doing, because clearly one of the reasons we selected this question is it is an interesting reflection of you got the ideas wrong. You're trying to do one bit of mewing but not the other bit of mewing. You're trying to just focus on here without actually getting the head and neck. And the way I'm looking at it is the more double chins you give yourself, and look at that, the Rosie's chin tuck, and I talk about giving yourself as many double chins as possible, which when I read your question means you're not understanding what we're doing or are trying to achieve. I'm thinking in nature, if you squeeze everything in here and hold that slowly over time, because it's under pressure, your face is gonna bounce out. The side effects from creating this pressure is the face is going to be pushed forwards, which is what you want. Okay, so actually you're saying, why don't my chins disappear, your double chins disappear, and I'm saying, well, you want them to appear. You've got it back to front. Go and get the Mewing app. I mean, you shouldn't be asking these questions. Right? You want to, you've got some idea of what's happening. Careful, that's where people go wrong. They say a little bit of knowledge can be dangerous. Get all the knowledge. That's going to help you on your journey. All right? Okay, so next question. Is it true that braces without extractions change your face or not? Interesting question. She's going on. Or that they narrow your palate. In my case, it was about the space between the front teeth. Then for 2 months, I wore class 2 elastics. Can you please answer Dr. Mike. All right, it's quite a lot to unpack out of this question. So first of all, is it true that braces without extraction? So we're removing the extraction debate here. There's a lot of concern, there's been a lot of concern by a lot of people over a long period of time that extractions can damage facial form. In some ways, that can be a little bit of a red herring. We could get to that, all right? Now, this is clearly a controversial subject, and I'm just going to give some opinions here. I'll try and stick to other people's opinions, and I'll make it clear when it's my opinion, all right? We've got to remember that within the conventional orthodontic world, they clearly don't understand the cause of the problem. All right, the cause of the problem is unknown. They talk about it being multifactorial, but again, I'm asking, how do you know it's multifactorial if you don't know the cause? And then, if it is multifactorial, what are the factors? Because you can only have one of those factors being genetic. All the other factors are going to be non-genetic. There's something in the environment. What are they? And why is the general orthodontic community not addressing those factors? You know, there's room for growth there, I think. I think it's really important for me to say we want to be collaborative. You know, I'm not here to be just negative about people. Let's work together to get better results. That's what we should be doing. Now, okay, so if you don't understand the cause of the problem, you don't understand the epidemiology, like where it started, where it came from. You don't understand the underlying pathological process. If something's genetic, you don't really need a pathological process. If something's due to the environment, you do. Somehow it's got to work. Now, if you don't understand all of that, well, then there's not been really good research on how braces can change faces. There has been a bit of research on, you know, looking at the profile and whether extractions can do this or this, but that's not what we're really talking about here. We're talking about the overall perspective. One thing I do notice is there's a real tendency when you look at the x-ray, we call them cephalometrics, orthodontics tends to lengthen faces a little bit. Now, I don't like longer faces, okay? Personal thing. I think I would agree that I'm not on my own. A lot of people don't like those longer faces as much. Maybe we could suggest that's encouraging a downswing in facial form, possibly because of some mechanics I would refer to as the coning effect with teeth, and possibly because it just makes it uncomfortable to bite together. You know, one of the common things I will do, and try this if you've got braces, if you put your fingers on these big muscles here, the masseter muscles, the power muscles with holding the jaw up, when I'm trying to assess whether someone's got good muscle function, I'll feel the masseter muscle. So when I do an examination during a consultation on someone, I put my fingers on the masseter, I get them to clench. And you can feel, look at my masseters. Good, strong masseters. You know, that's probably very weak compared to our ancestral ancestors. All right, but compared to most people watching this video, I would imagine my masseters are quite strong. So if someone comes in for a consultation, I'll stand behind them in the chair and I'll do it the other way up. I can't do that, my arms don't reach. But if I put my fingers along the occlusal line, this is the occlusal line here, where you'd bite. If I bit into that, that will be the occlusal plane. On the sides, it will be the occlusal line. And so I put my fingers along the occlusal line, little finger at the front, well, that'd be the other way around, but in this way, you can put the little front finger right at the front and the back finger right at the back, other fingers on there, and then clench, relax, clench. And that gives you a real good feeling of the muscle, just the muscle being used. And I'll make an assessment and I'll give a score of 1 to 5, 1 being really good, 5 being really bad, 3 being kind of average, and then the 2 and the 4 in betweeny. Now, I make that assessment on people when they sit down, and I get assessment of how strong their muscles are, and that's really important to me because clearly I believe that's one of the major factors determining facial development and facial growth direction. All right, what I have noticed conclusively, almost every single time, is if an individual is wearing fixed braces, they've got no muscle tone. You can feel they've got muscles, and it's a strange effect that you feel little bits of the muscle will be firing, but it's almost impossible for the whole muscle to fire together. The reason being is that normally, right now, my teeth fit together. you can hear that noise. They crunch together. So as my feet come together, hundreds of little points all touch together at exactly the same moment. The teeth have got their own mechanism so that they will rearrange themselves so that that occurs. Bang, they hit exactly. Now, you put fixed braces on and you're overriding that mechanism. So you determine where the teeth are going to be with the fixed braces, or rather the fixed brace is going to determine where the teeth are going to be depending on how you placed the mechanism, the mechanics of the brace. So now when you bite together, you don't have this independent suspension system that's moved the tooth around so that it fits. You've got the brace determining where the teeth are going to be. And of course, it's a little bit like, when you go to someone's house and they're having building work done, well, it's a bit of a mess, isn't it? Maybe the sink doesn't work, maybe the shower doesn't work because they're having building done. So during the process of orthodontic treatment is like having building work done. And during that phase, the teeth don't fit together comfortably. A few teeth are going to be overloaded. The tooth then has a feedback mechanism directly to the muscle, and that feedback mechanism is a little bit like when you burn yourself. You put your finger in a candle and you will pull back from the heat, the reaction. That's a short reflex, so it doesn't even go to your brain. Now, it's a little bit more complex in the head because it's different wiring, but effectively it's the same type. It's a short reflex. You all of a sudden open your mouth because you've overloaded it. Well, you inhibit the muscle fibers. You inhibit the closing of the jaw because one tooth has been overloaded. So it's a simple feedback mechanism. But while you've got fixed braces on, your muscles aren't going to be as effective. You inhibit the muscle effect. The muscle effect is a really important factor in determining whether you get crooked teeth or the underlying problem, craniofacial dystrophy. So what you're doing is you're switching off a really important mechanism by the teeth not fitting together. All right, so I said that there was two possibilities. We don't know. We don't have enough hard evidence. It's not really been done, but we've got the potential, this mechanical thing called the coning effect, and we've got this other effect with switching off the muscle forces. Okay, so those potential effects could affect facial form, not just this, but the whole facial form. As if what I've referred to as downswing. In the concept of craniofacial dystrophy, it's well described as a downswing in facial form. Your face is lengthening. That's what we tend to see from those X-ray cephalometric research. So sorry, that's a bit of a long explanation, but that's why I am. So you're saying, is it true that braces without extractions change your face or not? So I have a feeling that there's good evidence to suggest this is true. All right, there's a lot of people saying it's not true. Braces don't affect this, but then if you don't understand the cause or the pathology, you're not really in a good position to make that statement clearly, and we have a lack of research. I worry this research vacuum is a little problem within my profession. I would love to see more long-term research on faces and comparative research on faces. Look, we've got to do this, and I want to work to do that. All right. So then the second sentence of this question, or that they narrow your palate. Well, if you were to get a downswing in facial form, it would suggest as your face drops down a little bit like, so let's describe, we had a little toy, a child's toy, like a plastic head, yeah, or a silicone head. Now, as you stretch that head, it gets longer, the cross-sectional area is going to reduce. It's going to get narrower and shallower. And we think that's what's happened over time. Remember, our ancestors all had excess space for 32 teeth. They could probably have fitted 36 teeth. Today in a modern society, you are lucky to have space for 28 teeth. All right, a lot of people have extra teeth removed, so they have either 26 or 24 teeth, depending on the nature of that. Now, I'm guessing, Iona, that you didn't have extractions. I doubt you've got space for wisdom teeth. It's really common with people who have orthodontics, don't have space for wisdom teeth. My concern here is that a downswing in facial form can narrow the palate. All right, that could happen if logically all those steps were to progress, and that's a suspicion we're concerned about. That would then narrow the palate because we're reducing cross-sectional area. That's a very much overview concept. The more pressing thing would be how big the arch wire was. So if you have fixed braces, they're going to put the wire in your mouth. That's called an arch wire because it's the shape of an arch. This is your dental arch that's the shape of an arch. So it's called an arch wire. Now the shape of that arch wire will determine the width of your palate. Okay, and that will be more effective than the overall pattern as I described. Okay, not the best explanation, but I hope you understand. Then for 2 months, I wore class 2 elastics. So class 2 elastics, the attempt is to pull the lower jaw forwards, all right? Forwards with the lower jaw. So you wear elastics that go usually from the upper canine down to the bottom molar. And the idea is it's going to pull the bottom jaw forwards, but it clearly is also going to pull the top jaw backwards. When your teeth are together, I think it's mainly going to be a horizontal force because the teeth are together. But remember, most people hang their mouths open a lot of the time, particularly, in my opinion, people who have class 2 jaw set back, because they tend to sit like this. I feel that's what causes class 2, in part. So while you're hanging your mouth open, there's going to be a lot of vertical pulling, okay? You're going to pull the top teeth down and back and the bottom teeth up and forwards, all right? And that's just increasing this vertical increase, okay, which is reducing the cross-sectional area. Class 2 elastics are not my favorite, I promise you. All right, so in short, let's sum that up. Iona, my worry is that the braces, I'm saying fixed braces. I don't know as much about these Invisalign stuff. There's not been as much research on it. But I would imagine that quite a few of the same effects could occur. The jury's out, we don't know. So can braces change your face? A lot of people are highly suspicious that they can, particularly certain types of movement. All right, class 2 elastics, I worry that they could potentially be a culprit as well. So yeah, but what you really need, Iona, is go and get lots of old photographs. Okay, now there are programs out there that you can throw a load of photographs and particularly video in, and they will build you a 3-dimensional image of your face. That's what I highly recommend you go and do that. Go and look at old photographs, get a selection of old photographs and videos, throw them into a machine, and then get some modern images which you can take today, throw those into one of these machines, and then see if you can make a comparison. That's going to be the best way forwards. Look at the evidence, see what's happened, and I would suggest anyone does that. We really want to get 3-dimensional programs and apps that you can use. That's one of the next evolutions within the mewing world, is to gain records, because if you're watching this and it's your objective to get structural change in your face, you are crazy if you're not taking good records. Before you consider having any form of orthodontic therapy, you would be crazy not to take baseline records that you personally keep, okay? It's just, you're blind if you're moving forwards and you're not doing this. So Iona, I suggest you get some records, have a really good look at that, and try, make a big shout out if you get those records, and I would love to see them because it would be fascinating for me. Listen, thank you very much for the question. I hope that helped. A long explanation, but there was a lot to unpack in your seemingly simple question.